We've got a great group of speakers, and the effort right now for the next few hours is to try as best we can to get a handle. I can't even say we're going to be able to get a handle, but to get a hint of where we could go on the human health side of this issue. And I'm coming at this as someone who works on human health issues. I don't have expertise in microplastics, and so I stumbled onto the planning committee trying to sort of learn quickly on microplastics, but thinking about things from a human health and risk assessment perspective. And the way the National Academies has in the past laid out risk assessment is you start with the scoping and formulation steps. So here we are. I think that's very much what we're doing with this workshop. But then you look at things like, what is the hazard that we're talking about? Is it possible to look at any kind of dose-response relationships? What about the exposure to humans in particular? And then can you use all of that information to characterize risk and then just to sort of iteratively see if that is useful? And all of that requires thinking about uncertainty at every single stage, and we're already talking about uncertainty quite a bit, so I don't think that's going to be a challenge. In thinking about those pieces, one of the pieces is human exposure, and so we already have this question on the table. How are people exposed? Is seafood consumption the main issue? We'll be hearing about seafood consumption. What about other foods and water? We'll be touching on that. What about respiratory exposures to either particles or fibers? And then, unfortunately, there's nobody talking about the last piece about hand-to-mouth exposures in young kids, even though I actually think that might turn out to be an important one. I was amused by the picture on the lower right because it's about preventing lead exposure, but it shows a child chewing on a plastic toy, and it made me wonder what else he's getting. And obviously, we know that hand-to-mouth is important, is an important pathway for exposure to young humans for a lot of other things, and a lot of other particles, perhaps also for these. So I don't want to get into too many issues about human exposure, but we are going to be thinking about do these things get into the human body? If not, maybe do they affect the gut microbiome? We recently had a meeting on that in particular, and so there may be a relationship here. Where do they go internally? What about chemicals that may be adsorbed to them? We're going to hear a little bit about that. What about the issue of frustrated phagocytosis, where macrophages and other immune cells may be trying to engulf the particles, and then do they get how are they eliminated? We know they're eliminated fecally, but those may not be even particles that get into the body at all. So a lot of questions coming up, and a lot of questions on hazard assessment where we have a few studies at much higher than environmental concentrations that suggest some issues, but really at environmentally relevant concentrations we're very unclear except for the respirable range of particles, which is why I put those up separately, because there is information in humans, so-called flock worker's lung from inhalation of nylon flock, and then there's also some data, obviously, on PM 2.5, which includes tire wear particles and others. So here's our panel. We will be starting with Greg Zaris from the Agency for Toxic Substances and Disease Registry at CDC. He's going to be touching on a number of issues around both air exposure and also how CDC thinks about risk. Then we'll have Tava Palanisamy from the University of Newcastle. He flew the furthest to come to this meeting, and I'm thrilled that he's here to talk with us about, again, a variety of issues, including seafood and total human ingestion. Garth Covington will be joining us remotely, so we will have to patch him in for his presentation on seafood. Hong-Da Chen from the FDA, from USDA on food and agriculture exposure pathways, and then we'll have a break before we have Alan Burton. And then we have Nigel Walker here just for the panel discussion. He's with NTP, and he'll be helping to put some of the pieces together in the panel discussion. So it's going to be a great afternoon.